You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We have Texas's go-to implant dentist, Dr. James Sierra. Dr. Sierra, welcome to the program.
Happy to be here, Randy. Thank you for having me.
Now, I know you brought a stack of photos, so we're going to try to get to as many of those as possible. But for people that don't know your practice, like who's the typical implant patient that you see?
Yeah, so for the first group are patients with maybe missing teeth, broken teeth, and they maybe have a long history of dental pain and bleeding gums. So they think they're going to end up in a denture. So they find our office, and we were able to remove those teeth and put them into same-day teeth and give them a new smile. So the second group of patients are people who have dentures that are not happy. Many denture wearers aren't able to properly chew food. And for those patients, they walk in with no teeth, and then one day they can walk out with teeth on implants.
Now I asked you in the green room over there, if everything works out right, how many visits before they get their new teeth?
Well, this can be done.
You just said in two visits.
Yes, this can be done in as short as 2 visits. So we saw this one patient with a mouthful of bad teeth, and in one visit we were able to do a smile design and get him in at the next visit to give him new teeth.
The new teeth. So I'll put you on the spot. So if somebody's watching this today, and of course you'd have to have openings in your schedule, but if they're watching this today and they went for a consultation with you tomorrow, decide to move forward, they could have their teeth by the end of the week?
That's correct. If
in 2 visits?
It can be done that quickly, yes, sir.
Okay, good. Now, also correct me if I'm wrong on this, and I'm not trying to side with you. That's why I'm asking this. That the way dental implants are typically done, especially in Texas, you go to one office where they do the implants and another office where they put the teeth on top. You do both parts. Is that why you do it so quickly?
Yes, we have everything in-house. We have invested a lot in technology and training to where we're able to do the procedure from start to finish. Well, we actually have a new printer we got that's able to print a whole set of teeth in 10 minutes. So
you make their teeth right there?
Right, the same day, yes, sir.
Okay, good. Now, you brought some photos. So now these are all patients that instead of dentures, they got new teeth with implants. Is that correct?
Correct, yes.
Okay, let's take a look.
Yeah, so the first patient, here's her before image.
All right.
And she came to us with many years of suffering with bad teeth and broken teeth. She had a job in customer service at a bank, so she was had to communicate with people. And so she came to us with you may get an impression by her appearance and her demeanor.
Is that her version of a smile?
Yes, we had to kind of.
You say they don't want to smile. They don't want to smile.
Yes,
even if the dentist. They don't want to show you their teeth?
Yes, they come in and they're ashamed. A lot of times they're embarrassed, and they come across as maybe not friendly, but a lot of times it's their smile that's holding them back. So in her case, she was not able to eat much solid foods. Her teeth were very brittle, and so she really had to eat soft foods and really be careful.
Is it tough for them? You say it's tough, like when you have bad teeth, eat salads. It seems like that'd be an easy one. That's difficult.
That can be difficult. You have a hard time chewing the lettuce, and food gets caught in certain areas, so it's a challenge. And
biting an apple is out of the question for her?
Yeah, definitely can't bite an apple or a corn on a cob or even steak.
So what did you do for her?
So in her case, we were able to, we talked about her options, and she took an x-ray, and she ended up being a candidate for new teeth on implants. So we did a smile design, and then we got next appointment. We got her in with some light sedation, and we were able to fabricate her a new set of teeth on implants. Okay, let's take a look at the after. So here's her after picture, and we were just amazed by the transformation in her demeanor. She was much more confident, and every time she comes in, she gives us hugs, and just very a night and day difference in her personality. Look at the side-by-side, Randy.
Okay.
Wouldn't you say she looks younger in the after picture?
A little bit younger, yeah.
Her face just looks rejuvenated, and teeth can make you look more sophisticated. Would you say she looks more sophisticated?
That's true. You also said, we were talking about in the green room, that you become more attractive because teeth make you look better.
Yes.
And that's for a man looks more handsome, women look more attractive. What does a person like this say when they see themselves in the mirror for the first time? What's that like?
a lot of times they get very emotional. They may start crying. It's a very powerful visit when they see their after teeth, and it can be a life-changing thing for them. But I want you to look at that after, though. Look how the smile fits her face. A lot of these patients, this is soon after we delivered her same-day teeth, so she was still learning how to smile to show her new smile. A lot of patients.
What do you mean learning how to smile?
Well, they go for many years with hiding your smile, and so you don't. A lot of people don't smile big right away. It takes time for that to happen.
So she's not fully smiling yet?
Not in this picture.
So you think it'll get bigger, like after some compliments, things like that?
Yeah, it has. This case was actually done several years ago. So she, as we see her for her checkups, she has just a beautiful smile now. So she waited many years. A lot of our patients wait 5, 10, 20 years not liking their smile. And
they tell you that?
Yes, they say that. And they say their only regret afterwards is, why didn't I do this sooner?
Now, what about pain? It does seem painful.
Well, surprisingly, after getting the new teeth, there's very minimal pain in most patients. And the reason is you're removing the infection that they previously had, so the body has a chance to heal itself. And with implants, there's generally very little discomfort. And we also do very minimally invasive techniques to minimize that as well. A lot of our patients beforehand, they worry so much about the pain, but almost all of them say it's much easier than they're expecting.
Now they're numbed up, and most of them are getting sedation?
Yes, we sedate all of our patients, and we still make sure they're very numb, even for after that's day after, and so it's remarkable how little discomfort they have in most cases. So this next patient, Randy, he came to us with just having a hard time eating. He had upper lower partial dentures that were loose fitting. So they had him many years, so they would just fall out when he was trying to eat.
So they would come in and out every time he had to eat?
Yes.
Okay.
Yeah, he had many missing teeth, and he had a lot of loose teeth as well. So we talked to him about getting new teeth on implants, and so he ended up being a candidate for that. So we were able to do a smile design, and then the next visit we scheduled him for his appointment, to where we gave him new teeth on implants as well.
So upper and lower? Upper and lower. Let's take a look.
So here's his after image, and you can just tell by his smile.
Looks like a different guy.
Very happy, yes. Yeah, he's enjoying life now. He didn't have any more loose teeth, or loose partials anymore. He can eat steak. We actually got him a gift card for a steakhouse when he came.
Is that right?
Yes.
Do they have a specific food that they come in that they're missing that they want to eat? Like what's the common?
A lot of times it's steakhouses, things like that. And that was his favorite, so we were able to treat him to that. And
as far as maintenance, what does he do? Just like a
they don't come out. We like to see him once or twice a year for a cleaning. His teeth on implants don't ever come out, so we're able to just clean around him.
When it's all done, what does he say to you?
He was just very, very happy. He was surprised by how easy the process was and how little discomfort he had for it. Okay, good. Now you have a 3-step process to getting your new teeth, even though it could be done in 2 days or 2 visits. Yes. What is the process? Yes, well, the first step is to visit our office, where we take a 3D X-ray and we go over options, whether they want to do the top or the bottom or both. Okay. And we talk about financing options, and we do even offer sedation options. In most cases, we do IV sedation. And then from there, we schedule a second step, which is the fun part, where we do the digital smile design, where we're able to get input from the patients. We often ask if they have old pictures of smiles. Of what they used to look like. We're able to recreate things like that. Now, you do this on a computer? Like most of this design work is done? Yes, everything's digitally captured, and we now there's AI apps that are able to preview the smile for the patient, so they can have input in what it would look like. So you have some more photos. Let's take a look. Yeah. So this next patient, this nice lady, came to us. Again, she had a lot of broken teeth, missing teeth, bleeding gums. And she heard about us as doing this option with the new teeth. So is that her version of a smile? Yes, a lot of our patients we have a hard time getting a smile beforehand because they're just not used to showing teeth. So that was how she presented to us. And you may get an impression of someone based on the smile they give you beforehand. But when you look at her after picture, So in her case, we're able to again give her
Oh, wow.
same day teeth on implants, and you can just see a night and day difference in her demeanor as well. We were able to treat her top and bottom teeth and give her the smile restore her smile that she used to have on implants. So in her before picture, she was very reserved and very quiet, and she said she had a hard time eating, enjoying food, and eating well without pain. And in her after picture, she mentioned how active they are now, going to restaurants and traveling and just living life now.
Now, in your office, like for example, when I look at this and like pointy canine teeth, or how much of the design are you involved in?
Yeah,
of what it's going to end up looking like.
So when we do our digital smile design, we use our pictures and scanners to kind of mimic where her teeth used to be. We try to make it natural to the face. Every smile is unique, and it's very important that we plan it correctly beforehand.
Okay. Now, how many? Tell me about the amount of implants for a snap-in set of teeth, and then how many implants for teeth that don't come out on the upper and the lower. Tell me how that works.
And I actually don't like snap-in teeth.
Why? The snap-in dentures.
I don't like them because the patients don't like them. Because it's still a denture, and it's not natural. It still covers your palate, and it doesn't offer many advantages over a regular denture. So 2 implants minimum for a snap-in denture on the bottom, and maybe 2 to 4 on top for a snap-in denture, and for fixed teeth on implants, we do as little as 4. So,
and when you say fixed teeth, what do you mean?
So these are teeth that don't come out. That's for snap-in dentures. We still
they're
have
fixed
to take
in
them
place.
Out. Yes, and that's why a lot of our patients don't like the snap-in, because it's still a denture. And I like to say George Washington wore dentures 250 years ago. So I feel like the technology's gotten better, and there's better options available.
Now, why is it, especially here in California, why is it so many of the new dentists are pushing these snap-in dentures? Seems very popular, and you don't like them. So what's your take on that?
Well, it can be seen as a lower cost option for people, and it can be viewed by some clinicians as an easier option to do, because you don't have to invest in technology to be able to make it possible. Everything's still done the old-fashioned way with acrylic. So everybody wants are teeth that don't come out.
Okay. So how many implants for that? Like a lower full set of teeth?
As little as 4 implants.
Okay. What about the upper?
For the upper, we can do 4 as well, although I usually do 6 on the upper. But it's a similar process. We're able to do it in one day as well.
Okay, now, the denture wear. You say that their palate's covered, and that when they get this done, they like it the most. What's the difference?
So with a snap-in denture, you still have to cover the palate, which covers that keeps you from being able to taste food as well. A lot of people don't like covering the palate with the denture. So that's a key advantage of going to teeth that don't come out on implants, is you're able to not have the palate covered. So another thing, when your palate is uncovered, you're able to enjoy food, the texture, the taste, spicy, sweet food. All that's covered when the palate is covered. So it really enhances the ability of enjoying food in that case.
Now, we said at the beginning of this program, no more dentures, right? Do you think that's the future of dentistry, whether it's 20 years or 50 years? Dentures as we know them will not exist. They'll all be attached to something. What are your thoughts?
I do think the way the field is going, dentures are becoming just an outdated procedure. I think, and the people are getting more knowledgeable about the options of implants.
Yeah, but isn't it true though? I mean, if you've been wearing a denture, let's say 10 years, you can't do this. You don't have enough bone.
Well, Randy, I've had a patient that we treated that wore a denture for over 40 years. And we saw him, and we were able to, using these techniques, we were able to give him teeth on implants in one day for top and bottom.
So upper and lower teeth that don't come out.
And he, yes, and he had an interesting story. He had said he waited many years, and he wanted to. Him and his wife wanted to have it treated, but his wife passed away right before we saw him, and so he decided he still wanted to do it. So we were able to see him, and it was amazing to take that denture and throw it away after him having the new teeth and his new smile.
So 40 years.
Yeah, so for 40 years, he couldn't eat very well. His denture wasn't well fitting, and had lost a lot of bone throughout those years.
Are there lots of people like that? Like when we think of Texas, It's like healthy people. Are there a lot of people wearing dentures there? I mean, is this a big problem?
Yes, the studies show there are up to 30 million or more, 30 million people in the country without wearing dentures. So it's a big need.
So would you say there's tens of thousands of people in your state, or over 100,000 that are wearing an upper lower denture?
Oh, at least, yes. Yes, a lot of people have partial dentures or full dentures that they don't have to suffer anymore.
Now, if they all figured out how good this is, there's not even enough dentists to help them. Right? If 10,000 people or 100,000 people said, I want my new teeth, there's just like not enough dentists to do it.
That's correct. Yeah. And it's up to the patients are the ones that make the decision.
Yeah.
They're the ones that make that courageous decision to come to us. Many of them don't go to the dentist for many years, so they have a fear. So it's their decision to come to us and to make that investment in themselves.
So bone is not an issue anymore so much. The lack of bone.
Definitely, yes. With the new techniques, we're able to overcome that.
Okay. And how old? Like, what's the upper range? How old can you be to get this done?
I would say age is not even a factor. I've treated a patient that was 87.
Oh, wow.
His daughter had the procedure done, and he saw what she had, and he told her, I want that. So he made an appointment, and we saw him, and he had a condition of just a lot of broken teeth and collapsed teeth. So we were able to treat him. He was a candidate, so we did his design and got him in the next day to do his teeth on implants. And he's a patient that enjoys food. So every time we see him now, he talks about how much he's able to go out and enjoy food now. Even
now,
at
do you
87.
think it's even more important that a person 70 plus, 80 plus, or retired, they should for sure do their teeth because of the eating, because of the lifestyle?
Yes, a lot of people become malnourished if you don't have the proper diet. You're not able to eat. That can cause a lot of health problems. So a lot of times the dental infection can contribute if you have a lot of that can contribute to impeding your immune system. So a lot of times these patients get a lot healthier once you're able to get them in good teeth and be able to eat a proper diet.
Now, if you're in your 70s, statistically, you are on 3 or 4 medications. Can you be on medications and still get this done? Like diabetes medications, things like that?
Yes, so we do a thorough evaluation on each patient, and sometimes we have to get clearance from their physician, but we are able to treat most patients. If they're able to come into the office, in most cases we're able to treat them. So
if you had an 87-year-old that had this done, when somebody's 70 and says, Doc, am I too old? They're not even close to too old?
Exactly, yes. The average lifespan is increasing every year in the world. So, and a lot of times it's the quality of life. Those are the years that you want to enjoy your life, travel, enjoy food. So we hear that a lot. A lot of patients think they're too old, when they're many years left, yes.
So you're just not too old to do this?
I think there's no. I know of a doctor in Seattle who had treated a patient 102 years old with same-day teeth. So
upper and lower new teeth with implants.
Yes.
Interesting. Okay, time for some more photos.
Okay. So this patient came to us. We actually were able to. Her main concern, she had a lot of dental pain. She had an infection on one side of her jaw, so she was not able to chew for many years like that. And she also lost a front tooth, so that's what actually brought her in, because she had her graduation. So we were able to give her a new crown for that day. We did it the same day. I gave her a tooth for her graduation, but her teeth overall weren't in good condition. So we discussed the option of removing them and putting teeth on implants that don't come out. And she decided to do that, and so and one day we were able to do the procedure, get her in.
Let's take a look.
So here's her after picture, and
wow.
just amazing. Her smile, just a beautiful smile she has. So seeing her side by side now, without the jaw pain and the teeth pain she had, she's able to eat anything she wants now. She's just has a beautiful smile now. And the main thing, she's very grateful for not having the constant pain. She had a lot of pain on one side of her jaw. For a bridge, it was a infected bridge that she suffered for many years with it.
Now you're also kind of a TMJ expert. Is that correct? I mean, the way the teeth come together, because you do sleep dentistry,
yes,
you're boarded in that as well?
Yes, correct. I've had a big interest in oral facial pain and TMJ. It's an area a lot of people suffer from, and there's not a lot of expertise in that, in our field in that. So I've invested in learning about that as well. So it's amazing how correlated a good bite is to.
So the way your teeth come together also can cause you to lose your teeth early?
Exactly.
How so?
As your teeth get more worn down, or you lose teeth, the bite collapses and it causes your muscles to be more destructive, and they work harder. So that contributes to a lot of TMJ pain. Yes.
So how soon before her? I mean, how soon did her pain go away?
But very quickly, right after she got her teeth, and after the first week of healing, she was very happy, very little pain after that. So look, Randy, when you take someone out of pain that's been suffering for many years, it's a big deal. And in her case, she was able to enjoy her grandkids more, and to travel more, and to not suffer from the everyday pain she was having.
So what do they like more? How it looks, or what they could eat?
Well, some people like just being able to eat what they want confidently without having dental pain, and then some people just love the look. They have been ashamed of their smile, and it's such a confidence booster to be able to have a beautiful smile again.
Have you ever had people that they come in, all they care about is how it looks, and then they end up liking what they could eat?
Yes.
More than that part?
I would say that's a big, a lot of people don't think about how much they're not eating what they want. And so a lot of patients find that being able to eat what they want is just as important for them.
I think you told me, you have patients that say, "Doc, you've changed my life," when it's all done.
Yes, but I would say it's not me, it's them, because they're the ones that made the courageous decision to get it treated, to call us and come see us. And it's a big decision for a lot of people, especially when they've gone many years like this. So it's very admirable to see that people do that.
So you're just part of it.
Yeah, I just make it happen, but they're the ones that make the decision to do it.
Okay, good. Time for a couple more.
So this patient came to us in his late 80s, and he was headed for a denture with many broken teeth. And his daughter, we were able to treat a few months prior with new teeth on implants. She was also headed to a denture, and he saw what she had, and he just told her, "I want that." So
did she talk him into it a little bit?
Yeah, she brought him in, and we were able to see him, and we were able to treat him. So we were able to here's this after picture. In his situation, he loves to eat. He was always asking about what he could eat during the healing phase. So he's able to eat whatever he wants now.
So they ask you, like, "Doc, is it okay? Could I eat this? A steak?" Yes. Or
well, during the initial, we asked for a softer diet while healing. But once it's healed after a couple months, and anything they want.
Now, with a guy this age, when he's all healed up, can he bite into an apple or eat corn on the cob, or he has to be careful with certain things?
No, once he's healed up, then he can eat pretty much what he wants. In his case, he likes to eat chips and snacks, so he's enjoying that now for sure.
Okay, good. Let's take a look at some more.
Yeah, so our next patient here, younger patient for this procedure. But he came in with a toothache. We saw him, and we were able to get him out of pain. But then we saw he had a lot of gum disease and a lot of broken teeth as well. So we talked about doing the same procedure with the teeth on implants in one day, and he was very interested. He had suffered for many years going from dentist to dentist with.
So this is a guy that young that would have been in a denture?
Yes, he was
headed in that direction. Are there young people in dentures, like in their 40s?
Yes. Early in my career, I would see patients in their 20s in dentures. So it's even though it's not as common, but you still see it quite a bit these days.
Okay, so this is a guy. I guess the tip off. He has a toothache, so he finally comes in. Right? Are men like that? They wait until they're
to the last minute until they're in so much pain. His wife had him come in, made an appointment.
Okay.
So what we did for him, Randy, was made him upper and lower teeth on implants.
Let's take a look.
And so here's his after picture.
Oh, wow. He looks a lot more handsome.
Yes, but it's not just him, it's everyone. Everyone looks better with a nice smile.
With good-looking teeth.
Yes.
Now, we talked a little bit about this at the break, that the trajectory of this guy's life is different. Elaborate on that, what you mean by that.
Well, just being more confident in his smile. He was able to, I think he got a promotion in his job. He's just much happier person now that he's has
because
a confident
of the self-confidence.
Smile. Yes.
Very nice. And so his wife drags him in to get it done. What is did she end up telling you? What does she think?
Yes, she was just very, very happy that he was out of pain and in a healthier situation than he was.
Okay, good. We're going to rush you because I only have a couple of minutes left and you have more photos.
Yeah, so another patient here, a younger man we saw. Again, he also had crowns on his front teeth, but all his back teeth were decayed, and he had a lot of tooth pain as well. He could
he can't eat
even air, even breathing through his mouth. It would hurt. Yes, very just constant pain he had, and we did we brought him into the office and did his consultation, and saw he was a candidate for teeth on implants. So we were able to treat his top and bottom teeth as well, and
you call it same-day teeth.
Yes, so in one day we were able to 3D print place the implants guided, remove his infected teeth, and place teeth on the implants that don't come out. And
when this guy gets it done, what does he say? Like when he's looking at himself in the mirror, do you remember?
Yeah, he was just almost in tears, very, very happy with not to be in pain and to have a nice, confident smile again.
Okay, time for one more.
One more. So this patient, another patient we saw with a lot of cavities, decay in his teeth.
Now those teeth, is that unusual to have teeth like that?
It's not unusual, but you don't see it because they don't smile. It's because they're grumpy.
Okay.
So this gentleman, we also saw him, very nice man. And we're able to treat him as well with his new smile. And you can just tell by the confidence he shows here in his new smile.
So these are new teeth on implants.
Yes. Look at how it's changed his appearance, Randy. You can tell in his smile. He's much more confident.
He does. He looks younger.
Yes.
Just because of the teeth make a big difference.
Oh, yes.
Do they have say-so? Do they get a chance to look at a little bit of what their teeth may look like when it's all done? Like on the console?
Yes, so the smile design, we're able to kind of show them a preview of what the...
Like you show it on a big screen?
Yes.
Do they ever say, I want that? Or are they ever shocked or surprised at what they say?
A lot of people are. It really is informative to see what it would look like. People don't realize the difference it can make in their appearance. And it's very important for the planning, too, to know what the teeth need to look like.
Okay, good. And so with IV sedation, you're monitoring their vital signs?
Yeah, so we bring in anesthesiologists for these procedures, and they monitor the patient's vitals and make sure everything's healthy for the procedure.
So, final message, somebody watching this, the two groups, one's wearing a denture, the other one has really bad teeth and gums, and they don't want a denture. They've heard what you have to say, but for whatever reason, they're still skeptical or afraid. What do you say to them?
I would advise you to come into our office and explore our options and find out how affordable it can be for you.
And they meet with you?
Yes, I will be happy to meet you.
I want to thank you for coming on the show. Do you prefer they go to the website, make an online appointment, or just call your office?
Easiest way is just to call our office at our phone number, and we'll be happy to see you.
Does everybody get a chance to see you on the consults?
Yeah, I see every consult.
So you see everybody?
Myself. Yes, I do.
Okay, good. Thanks again. Good stuff.
Thank you for having me.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.